Hello, I'm Saleyha Ahsan, and I am calling you from the middle of the desert in Jordan, near Wadi Ram. I'm so sorry that I have had to resort to a video. Unfortunately, the internet hasn't allowed me to join the panel discussion, but I wanted to contribute to this really important discussion about well-being, solidarity for the global healthcare workforce, especially at these times with COVID and what we've been through. For a rather long time, I've been looking at the issue of abuse and attacks against healthcare in armed conflict and austere settings. And it always involved me packing a bag, saying goodbye to loved ones, and getting on an airplane and flying to somewhere far away from home to help, to roll my sleeves up, to show solidarity with people who live and work in settings that are facing challenges such as war or some emergency situation. In 2020, last year, I found that I was living in an environment that resembled the kind of situation that I would be flying off to help, but this time there was nowhere to fly to. I just literally had to get in my car and drive to work. And it was that same mindset of something that is out of our normal, something that is going to push us and challenge us, is happening right here and now. And it was very humbling. And it really struck home that this was the case when I got a phone call from colleagues who I had worked with in Tripoli in 2012 during the civil war in Libya, where I had been working alongside Libyan surgeons in Tripoli. And this time they were calling me last year to check if I was okay and if my family were okay and if they could do anything to help. Now that was incredibly humbling. And that, on a micro level, is what solidarity is, and it's from shared experiences, relationships that have been built, from wanting to help and connect with people who are going through challenging times. Those bonds can't be easily manufactured. They're not your parachute in, parachute out kind of bonds. These are long-standing and these are friendships, in fact, that have formed. And it was indeed a really humbling moment, and I realized that there was nowhere to run. This is it. There's no plane out of here. We are living in this situation with COVID. My work has evolved to looking at attacks against healthcare in armed conflict, both pre and during COVID. I'm doing a PhD at Cambridge looking at this issue. I have my experiences, and I have yet to find others who share my sort of skill set in this area. So I often find that being able to talk to people who have who've been trained in the military, who've done active service, and then went on to work in a humanitarian way in an armed conflict, and then become the target because they're a healthcare worker. At the moment, I'm the only one that I know. But I am keen to reach out to others who have been in that situation. I want to reach out and share experiences and understandings of them. So again, if anyone in the audience has that experience, I'd be super keen to hear and connect. So I'm putting this out, and this is me wanting to connect because I feel the need for solidarity and support in this. And this is maybe this is me calling out, but it's also for me to show solidarity to those who I know I will have a shared experience with. There are plenty of people right now, currently in the last few years, who've picked up looking at attacks against healthcare in armed conflict and in austere settings. But, despite their incredible research, it's and work from wherever they are in London or New York or Manchester, it's the people that I'm wishing to connect with who are there in it right now, and who have seen things from the perspective of being in the military, and then having worked as healthcare workers themselves, because I feel that this is a really unique position that is at the core and the centre of a lot of this. And I feel that we need to understand this area so that we can try to build on it and try to improve and ultimately find a way to safeguard healthcare in all sorts of settings. And it is our responsibility to do this, because I feel that there's been an erosion of the almost of the sacredness that we have held healthcare in the past separately. I know there were times in history where it wasn't so protected, but then we went through a period of time, especially after the 1800s, where rules and laws were created to try to protect injured military personnel in times of war and to humanize war a little bit, if you can say that. And the laws of battlefield were developed. But what I feared as I watched healthcare workers, ambulances, healthcare facilities in countries like Syria, Libya, Palestine even, and in sub-Saharan Africa, where there have been intrusions into those areas marked with a Red Cross or a Red Crescent, I wondered whether this would lead to an erosion of respect, if there was no accountability, if there was no hard action from international agencies to prevent this, not just to condemn it, or to offer up another resolution, but to really physically do something about it, to enforce in any way possible the existing laws. Then I felt that there was going to be a knock-on effect. And we are now living in a world where, even here in the UK, within the NHS, we are facing abuse. We are facing even violence for working as healthcare workers on the COVID frontline. Headlines every day in the press report entire GP practices suffering from the lack of staff, because everyone from the receptionist to the doctor and everyone in between are leaving because of the tirade of abuse that they are facing by disgruntled and angry patients. And in A&E settings as well, again, the Royal College of Emergency Medicine president has spoken out today, I believe, about abuse and violence that's being suffered within the emergency setting. I feel it is in all of our best interest to come together to condemn violence and abuse against healthcare workers and to show solidarity with those that are in the line of fire at all levels, whoever that healthcare worker is. I'm not just talking about the doctor or the nurse, I'm talking about everyone, from security on the front door to the receptionist, to the porter, to the domestics that keep the workplace clean and tidy and sterile for everyone. And of course the doctors and nurses and other patients as well. I'm very sorry that I can't join this panel discussion because of the technical challenges I've had today. But these kind of technical challenges are representative of what people who work in austere settings are faced with. So, you know, we've just got to innovate and find ways to make our voices heard. So I wish you all well, and thank you for offering me the opportunity to at least contribute and say what I would have brought to the discussion anyway. And please do connect with me if you are within the field of working in austere settings and are facing challenges on delivering healthcare because of abuse. I would very much like to connect and see how I could work with you. Thank you.